So I would like to introduce to you all Dr. Melissa Henke, who is the medical director. I'll go ahead. Who is medical director for the Heartview Foundation, and we are so thankful for her to be here this evening talking about shame and compassion.
Well, thank you guys for coming. I'm really excited to be here. I will tell you, this has been my home church for the last 16 years, and when we moved to Bismarck, we were looking for a church, and Trinity struck me because Carrie's Kids was started in these walls, and the banquet was going on in these walls, and I thought, I want a church that does boots on the ground work in our communities, and we've always done that here, and so I was super excited when Pastor Mark said, hey, you know what, we need to do something. We can't be that church that just locks their doors and pretends this isn't happening. And so I'm really excited to be here and talk to you guys about some of this stuff. We're gonna go over just some prevalence kind of things, and then I really want to focus on stigma and compassion. People ask me all the time, well, Doc, what can I do? What can I do? I'm not a doctor, I'm not a nurse, what can I do? And it's like, well, you could be kind, you could stop the judgment, you could, say nice things, you could be a good human, right? That's what we want to do for our kids. We want them to be good humans. But as adults, sometimes we forget that and we get a little bit catty. And so if you can't do anything else, just be kind. So, and this is a really busy slide, but I kind of circled the things I want you to know about, which is mental health. 1 in 5 of us will deal with a mental illness in our lifetime. 1 in 5. I don't know how many people are here in this room, but it's more than 5, right? It's pretty prevalent. Some of the other stats, 90% of people who commit suicide will have a mental illness, right? That's significant. And only 56% of people who have a mental illness will get treatment. 56%. What if only 56% of people with heart disease got treatment? We'd be appalled, right? Well, guess what? When it comes to addiction, that number gets worse. 10% of people with a substance use disorder get evidence-based treatment. 10%. That is truly horrifying, right? So I'm a breast cancer survivor. If only 10% of people with breast cancer got treatment, there would be outrage. Why are we okay that only 10% of people with a substance use disorder get treatment? And a lot of that stems from stigma, right? So what is stigma? Well, the origin of the word comes from the Greek wording meaning tattoo or puncture mark, right? They used to brand slaves. That way everyone knew they were a slave. They marked them as less than. You are less than me, right? Goffman said it reduces someone from a whole unusual person to a tainted and discounted one, right? You're less than me. I'm going to mark you, right? And basically, what happened in Oxford says it's a mark of disgrace or censure, right? You brand someone. It's a horrible thing to think about branding someone, right? This has been done before. We would be horrified if this happened now. Right? The idea of making someone wear a gold star, the idea of actually tattooing someone to say, you are less than me, that's what stigma is. Look what stigma did in Nazi Germany. Killed millions of people. And people stood by and watched, right? How many people are dying now in this country and we stand by and watch, right? We're not branding them anymore. We don't make them wear a gold star, but we're not standing at the Capitol saying, it is unacceptable to me that 10% of people get treatment. We should be doing that because it is unacceptable, right? People are people. Put a gold star on them, it doesn't change who they are, right? As Pastor Mark said, we're all beloved, right? God calls us to be compassionate. He does not call us to brand our neighbor. So what is this stigma word, right? Well, public stigma occurs when the general public endorses negative stereotypes and then discriminates against a group of people, right? So we say, you know what? People that are addicts, they don't have jobs. They don't take care of their kids, right? And then what happens? Well, people that have a substance use disorder, they're excluded because they're addicts. They don't have jobs. They don't take care of their kids. They don't go to work. They don't do those things. They don't pay their bills. And then what happens? Basically, it feeds into that whole idea because people that have substance use disorders don't get jobs. And then guess what? Nobody wants to hire them. So then they don't get jobs. And they don't have homes for their kids because no one will rent to them. So then they don't have homes for their kids, right? So it feeds into it and exacerbates and it creates this whole problem of we want them to have jobs and take care of their kids, but we basically build it into the system that they can't have jobs and take care of their kids, right? So then what happens we have this public idea that these people are untrustworthy and they're unhelpful and they're a drain on society. Well, if you're one of those people, you take that on. Because if everyone thinks something about you, pretty soon it becomes true, right? So then you internalize that and you're like, you know what? I don't have a job. I don't take care of my kids. Maybe they're right about me. Why should I go apply for a job? I've been rejected 14 times this week. No one's going to hire me. I might as well sell drugs. Those people will talk to me, right? So we get this shame and reduced self-esteem, social withdrawal, hopelessness. And you know what? If I'm going to feel that way, I might as well use drugs. At least then I get a break from the misery. And then we can say, see, they go back to using drugs. That's what happens. They just go back to using drugs. But we don't give them another route. We make it so that's the only way that they can go. So what happens? Well, I don't want to go get help. If I go get help, then I have a label, right? It'd be in my Sanford My Chart that I have an alcohol use disorder. Now, every provider I ever see at Sanford's going to pull that up and say, well, you're an alcoholic, I see. Great. Now I can't get decent treatment because of stigma again. Because physicians, nurses, hospitals, they all participate in that stigma, right? You get treated differently. You guys are all nodding. I know you know it, right? What about, I'm frustrated, so I might act out, right? We don't fund addiction treatment the same way we fund breast cancer treatment or heart disease, right? Do you see billboards that say, we're the #1 substance use treatment disorder in the country? No, but you see we're the #1 heart hospital, we're the #1 cancer center, right? Nobody wants to say we treat substance use disorders, we treat mental illness, right? We don't get the same funding, so we can't afford a billboard. We just have to do the work, right? And suicidality is a huge component of substance use disorders. Again, if you feel worthless, if you feel ashamed, if people don't care about you and they don't want to hire you, pretty soon you're like, you know what? Why am I trying so hard? It takes effort to just get up every day. I'm not sure that I want to do that. And then we have shame. So when we look at this cycle, it starts with stigma, right? It starts with this inherent idea we have that people are less than us. I'm a little bit better. I'm a Christian. I go to church on Wednesdays. Probably better than you. Got a job, right? No better than anyone else. There before the grace of God go I. Tell my patients all the time, the reason I'm in this chair instead of that one is I was dealt a different hand, right? I'm grateful. I'm blessed. I'm beloved. But so are you, right? So that stigma contributes to this negative perception of mental illness and substance use disorders. And then there's this fear of discrimination. I'm not going to get help because people are going to treat me different. It's going to be in my chart, right? We all have a my chart. So I don't get help, which means I don't get treatment, which means maybe I don't get a job and maybe I don't take care of my kids, and that contributes to the stigma, and we go round and round in this horrible cycle. So what if we took out stigma? What if we took that out? And then we didn't have these negative perceptions and this fear and this avoidance and all of that. Well, then we'd have a stigma-free society. And then we'd have this awareness, right? That's why we're doing this, for awareness. So people can say, you know what? 1 in 5 people will have a mental illness. 1 in 7 will have a substance use disorder. You know what that means? It affects all of us. It could be your kids' kindergarten teacher. It could be the lady at the grocery store that you like so well. It could be your dietitian. You don't know, but I guarantee you know someone. But because of stigma, they might be afraid to even tell you that. Understanding and acceptance, right? At the end of the day, don't we just want to be accepted? Don't you just want someone to say, you're okay, you're all right, right? I just want to belong somewhere, and that's what I think Trinity needs to do, right? Compassion. What combats stigma? Compassion. So compassion is just a sensitivity to suffering in self and others with a commitment to try to alleviate and prevent it. It's not just recognizing that someone's suffering. It's saying, someone is suffering, and you know what? I think I can do something. I think I can be better. I think I can help this person. Basically, it's just this idea of showing care and concern. And I include this statistic about medical school and residency because sadly, throughout med school training and residency, they measure compassion scores and they go down throughout our training. Isn't that horrible? As a physician, I'm less likely to be compassionate than I was in high school. That's embarrassing. I should be more compassionate because I now have truly frontline seen the suffering of others. But that's not what happens because we get burnout and compassion fatigue and all of those things. And we're all susceptible to that. So compassion has to be an active process, right? So 3 elements: notice it, feel something, and then respond. It's not complicated, right? You see the suffering in others and you say, whoa, that's terrible. And then you do something about it. Compassion promotes welfare and increases mental health, not just for the person I'm expressing compassion for, but for myself. Showing compassion to others helps me be compassionate to myself. It's sensitivity, sympathy, empathy, motivation, caring, non-judgment, and I don't care what religion you are. Compassion is a core component of it. God calls us to be compassionate. He says, love thy neighbor. He doesn't say, love thy neighbor unless they're like Jewish or gay or black or addicted or mentally ill. No, there's no buts. Love thy neighbor, period, right? It stops there. We have to show compassion. That's all that love is compassion, right? The people that we love, we don't want them to suffer. That's really what it is. And it contributes to psychological, spiritual, and social health across the board. But if you don't show compassion to yourself, it is incomplete, right? So one of the things that I talk with my patients about all the time is give yourself some grace, right? I didn't wake up perfect this morning. You didn't wake up perfect this morning. Pastor Mark said a few weeks ago, the first sinner I see every day is the one in the mirror, right? None of us are perfect. But you have to give yourself some grace. You don't get to be 46 years old without really hurting some people along the way, without really making some terrible mistakes, without damaging some people, including yourself. So give yourself some grace. If you can't give yourself compassion, you're not going to be able to give anyone else compassion either. So self-compassion is basically extending compassion to yourself in a time of suffering. So instead of beating yourself up because you failed, give yourself some grace. And if you can do that to yourself, it's much easier to do it to someone else. If we stop judging ourselves, we'll stop judging other people, right? Sometimes it's a deflection. Like, oh, I know I'm having a lousy day and I yelled at my kids and I swore 16 times on the way to work. So then I come to work and I want to be snotty to my nurses. And it's like, well, that's not really their fault, right? If I give myself some grace, I can probably give other people some grace too. A higher level of self-compassion is related to fewer mental health symptoms, right? So we're talking about mental health and substance use. If I can be compassionate to myself, I'm going to sleep better, less depression, less anxiety, less guilt, less shame, all of those things, right? Significantly associated, again, sleep and all, decrease in stress. How many of us felt stressed during COVID? How many of us homeschooled our kids, right? How many of us did the things and thought we weren't going to make it another day, right? How many of the kids got tired of crock-pot meals? Right? So if we can just give ourselves some grace, we feel better. The people around us feel better. We are kinder, gentler humans, right? Less ruminations. You guys know what ruminations is? So cows are ruminants. They chew things and swallow them and then chew them again, right? Ruminating is that constant chewing on things. If we can give ourselves grace, we're less likely to chew on things. Because we never chew on the positive things. Nobody sits in bed at night and goes, man, such a good day. I should think about all day long what a great person I was. No. We lay in bed and go, man, I can't believe that was how I acted when that person said this. I can't believe that I did this. I can't believe that I did that. This is terrible, right? Instead of saying, you know what, God? I'm giving it to you today. Try again tomorrow, right? First sinner I see will be the one in the mirror. Mindfulness, basically being mindful is understanding that you have emotions, acknowledging them, and working through them. We all have emotions. So when someone says, how are you? Granted, if it's a lady at the grocery store, just say fine, right? Fine. But if it's someone who loves you and they say, how are you? Don't just say fine, right? Oh, how am I? My nurse asked me today, she goes, how are you? And I'm like, you know what? I'm overwhelmed, stressed. I have 4 presentations today, only 2 of which I'm prepared for, and you know what? I need to go for a walk. So I walked around the block, right? But I had to own it. I wasn't in a good headspace. If we don't own it, we can't do anything about it. We can't just say, fine, I'm fine, right? And if we can do mindfulness-based meditation and be aware of our emotions, actually own them. You know, sometimes with my kids, I'll be really snappy, and I'm like, why am I snapping at them? who am I really upset with? It's not usually them, right? It's something else that happened. But don't ignore it. Don't stuff it. Don't put it in a box. Own it. Sometimes when you're really happy, why am I really happy today? Oh, I probably slept good last night. I maybe exercised yesterday. I probably drank enough water, right? We have to do a better job of actually being introspective and figuring out what's going on with ourselves. Resiliency, right? This idea of being resilient. Everyone sitting in this room is resilient. You don't get this far in life without overcoming something, whatever it might be, whether it is addiction or sexual abuse or abandonment issues or a horrible trauma or cancer or heart disease. We're all resilient. The fact that we wake up every day demonstrates resiliency, right? When we are resilient, we can reduce stress. If we can own that we are resilient, you know what? Some days I'm like, oh yeah, I got this. And that's not very often. But on those days when I feel empowered and I feel strong, I have less stress. I am less overwhelmed, right? So good sleep, healthy diet, exercise, self-care, self-compassion, all of those things make us more resilient. And again, COVID sort of changed the game in all this. We became less resilient. We didn't exercise. We didn't eat healthy. We didn't do the things we needed to do. We became less resilient. It's time to take it back, right? It's time to get back to doing the things that we know we need to do. And again, I'm a fast talker. I should have warned you guys, you have to be fast listeners. So what I want you to take home from this, mental health and substance use disorders are incredibly prevalent. 1 in 5 and 1 in 7, right? That's a lot. We talk about breast cancer, right? And again, I used to be super annoyed by Pinktober, and now I just embrace the heck out of it, right? 1 in 8 women will deal with breast cancer. But every October, everything is pink. But that's only 1 in 8 women, significantly less for men. But we're talking about 1 in 5 with a mental illness and 1 in 7 with a substance use disorder. Way more prevalent, right? We have to have the conversations. When I was a kid, there was a woman in my town who lost her hair. And I said to my mom, what's going on with her? And she goes, she has breast cancer. Because it was like taboo to talk about breasts. Now look at what we do. Oh my gosh, we've got obnoxious shirts and we've got all of this stuff because we have the conversations. And you know what has happened to care for breast cancer? Life expectancy has gone through the roof. We have better chemotherapy, we have better surgeries, we have better radiation, we have better treatment. So if we can have the conversations about mental illness and substance use disorders in that same way, instead of whispering about it, maybe we'll get better treatment. Maybe we'll see success rates go through the roof like we did with breast cancer and heart disease. But we have to be willing to have the conversations. We have to be willing to say, you know what? I'm a part of this community, and maybe I don't deal with either one of these things, but I'm going to talk about it. And I'm going to show compassion, and I'm going to do the things. I'm going to be a good neighbor. I'm going to love my neighbor like God commands me to do. Stigma keeps people from getting treatment. Again, I don't want it in my chart. I don't want people to know, right? We talk about breast cancer, we talk about all those things, but I don't want people to know that about me. That's stigma. All of us can do something to reduce stigma. If you can't do anything else, just be kind. Stop judging the person down the road, you know, when their kid goes to treatment. Oh, did you hear so-and-so's son had to go to drug treatment? Instead of, you know what, we should pray for so-and-so because her son had to go to drug treatment. It's a horrible illness, addiction. It is horrible. It is ravaging, it is deceptive, it is manipulative, and it is lethal. And we need to talk about it in those terms instead of as if it's some sort of moral weakness. It isn't that. It is a horrible, lethal illness. Compassion contributes to psychological, spiritual, and social health for all of us, for our whole communities. If we could be more compassionate, our communities would be nicer places to raise our kids. We wouldn't have to talk about bullying all the time. We wouldn't have to talk about stigma all the time because we would just love thy neighbor. Self-compassion helps us to be more compassionate to others. So give yourself some grace. You didn't wake up perfect today. You're not going to tomorrow either, or the next day, or ever again. It's not going to happen. So you might as well just put that out of your head and decide to give yourself some grace, right? Forgive yourself for the mistakes that you're going to make. Lack of self-compassion is linked to mental illness. So if you can't give yourself some grace, Unfortunately, you're more likely to struggle with depression, anxiety, insomnia, all of those things. And this church, this incredible community, can be that place where people can come and feel loved instead of judged. If at the end of the day, that's all that we do is let this be a safe place for someone to come with their kids and to say, you know what? This is a place where I feel like I can have a conversation and no one's going to go, oh, did she just say she has a substance? Did she say she's an addict? It's like, yeah, probably not going to steal the communion wafers. Probably not going to, get those thoughts out of your head, right? Treat people like people. And at the end of the day, the Dalai Lama said, be kind whenever possible. It is always possible, right? Always. There's never a day where it's like, I don't know, of all the things, I just can't be nice today. No, you can probably always be nice, right? That's one thing we can always, if you have nothing else to give your kindness. And nobody cares how much you know until they know how much you care. I mean, I could throw stats at you all day long. None of my patients care what my grades were in med school, how I did in college. They could care less. They know that I care. They know that I want them to succeed, that I celebrate their accomplishments with them, and I mourn their losses with them. That's really all people care about, right? So at the end of the day, whatever you take away from this, just be kind and care about your neighbor. And so that is really all I have to say.